my name is Daniela, and today I will be discussing the article Hospital Mergers and Acquisitions, Does Market Consolidation Harm Patients? This article is written by Vivian Ho and Barton H. Hamilton. As soon as I saw the title of this article, I knew I wanted to present on it because the facility I currently work at is undergoing a merger between the campus I used to work at and the campus I currently work at. So I thought it'd be interesting to see some of what might be expected with this merger. Going into reading this article, I thought that merging facilities would not have a harm on patients and that quality would actually increase. The authors of this article had the opposite thought. They hypothesized that merging hospitals would decrease the quality of patient care. So this article aims to examine the quality of care provided to patients before and after the hospital or hospital system at which the patient received care was merged or acquired by another hospital or hospital system. This study is a bit outdated, being researched in 1998 and published in 2000, but as stated in this article and proven by some of my own research, there are not too many publications on this topic. I think that's a shame because it really is an interesting topic, although after reading this article I can understand how difficult it is, which I will also touch on a bit in this presentation. This study uses data collected from the American Hospital Association, or AHA, annual survey of hospitals from California hospitals between 1991 and 1995. The researchers chose this market because, one, hospital consolidation was in abundance at this time and place, and two, patient discharge data is readily available. This article studied three areas. One, inpatient mortality for myocardial infarction, or MI, in stroke patients. Two, 90-day readmission for MI patients. And three, the discharge within 48 hours for normal newborn babies. And they chose this last area because in 1996, the Mothers Health Protection Act was enacted, which required coverage of a 48-hour hospital stay for normal newborn babies. This was seen as the optimal time for the best health for the mother and the child. Therefore, 48 hours is used as a quality measure in this study. So there are many reasons why mergers and acquisitions, or M&As, may occur. One reason is the increasing cost of maintaining multiple campuses. Perhaps consolidating into one geographical location saves the organization money. But does this cut down on the quality of care? This article hypothesizes that the quality of patient care does in fact decrease in association with M&As. In addition, there are a few differences between mergers and acquisitions, which these authors point out at the beginning of their article. And you can see a few of the differences that they listed here on this slide. This article will examine both mergers and acquisitions. Together, they call it consolidations. Through tedious studies, Ho and Hamilton drew the displayed results on this slide. You can see that the mortality rate for MI and stroke patients decreased, starting at 9.8% in 1991 and decreasing to 9.3% in 1995 for merged hospitals, and for acquired hospitals, it started at 8.6% in 1991 and decreased to 7.9% in 1995. So, for 90-day readmission rate for MI patients, that rate also decreased, going from 8.7% in 1991 to 8.3% in 1995 for merged hospitals, and from 8.9% in 1991 to 8.3% in 1995 for acquired hospitals. And the normal newborn discharged within 1 day rate increased. Um, this this went from 52% in 1991 to 65% in 1995 for merged hospitals, and from 52% in 1991 to 69% in 1995 for acquired hospitals. So if you recall from a previous slide, 48 hours is seen as the optimal time at which a normal newborn baby can be discharged. So a normal newborn baby being discharged less than 48 hours is seen as harmful to the health of the baby and the mother, which means that the increase in discharges for a normal newborn baby within 1 day, as shown here, is seen as a decrease in the quality of care. Sorry about that. As mentioned before, this type of research is limited because it is difficult to conduct. There are many factors that can contribute to misrepresentation or skewed data. For example, did mortality rates decrease because hospitals were merged and therefore practices were at a higher quality? Or did new developments in medicine and treatment during the time of this study lead to decreases in MI and stroke patients? This can be a valid argument based on the fact that mortality rates of these types of patients also decreased in facilities that were not consolidated. As well, some variables had to be excluded from this study due to missing information on length of stay or lack of proper diagnosis documentation. So while the calculations are as accurate as the researchers could get them, there is still some information missing that could contribute to the margin of error. These considerations led Ho and Hamilton to conclude that inpatient mortality was not affected, that the 90-day readmission rates were only slightly increased, and that early discharge for newborns were also only slightly increased. In October of 2011, Tamara Hayford published another study on the effects of hospital mergers on quality care. This paper was titled "The Impact of Hospital Mergers on Treatment Intensity and Health Outcomes." Part of the study examined inpatient mortality rates. Data from this study was also collected from California, but this time from between 1990 and 2006. So a few more years were added from the study that Ho and Hamilton completed. Although Hayford experienced some possible data skewing issues, she was still able to confidently conclude that inpatient mortality rate increased by 1.7%. This is a conclusion that Ho and Hamilton could not draw from their research. So in conclusion, I do believe these are two very interesting articles. They're definitely worth a read. The links are provided here for you. I was surprised by the data that they collected. I was also surprised that it was not as confidently concluded as the researchers and I had hoped to be. Very small increases and decreases were shown, and it really does have a lot to do with the data not being completed and various small variables that would just be impossible to account for. But I hope you enjoyed it, and I look forward to hearing your questions and comments. Thanks. Have a great day.